Welcome to this first podcast for dental health professionals exploring the North Wales Dental Academy. We have a distinguished panel of guests, so before we get to meat of the discussion, I'll introduce them to you. First off, we have Dr. Adrian Thorp. He's the Health Education and Improvement Wales lead for the North Wales Dental Academy. Among his impressive array of titles, he is the Training Programme Director for Foundation Training in North Wales and Lead Dental Practice Advisor for Public Health Wales. A specialist in oral surgery, he continues in his dental practice advisor role with Betsy Cadwallader, and he owns a 7-surgery practice in North Wales. He's board member for the membership of the Faculty of Dental Surgeons Examination at the Royal College of Surgeons and sits on the Speciality Advisory Committee for Oral Surgery in the UK. In addition, he's secretary to the British Association of Oral Surgeons. Paul Brocklehurst is one of 2 Deputy Chief Dental Officers for Wales and an Honorary Consultant in Dental Public Health for Public Health Wales. He is also the Director of the Trials Unit at Bangor University and an active researcher with an interest in the care of older people and workforce design in dentistry. Peter Greensmith is the Assistant Director of North Wales Dental Service, which covers all aspects of primary care dentistry, community dental, general dental services, intermediate tier, urgent dental services, and the North Wales Dental Helpline. Peter has overall responsibility for the commissioning and delivery of services, strategy planning, and service improvement. The North Wales Dental Academy Project Director role appealed to him as it was the opportunity to lead a project that will deliver great benefits to the local population, he said, and to dental services as a whole. He has a strong drive to deliver innovation, experience of managing change and continuous improvement, business development and innovation. He's worked with PCT, CCG and Mental Health Foundation trusts in England, as well as working in prison healthcare and secondary care treatment centres for an independent sector NHS delivery organisation. Fiona Sandom. Fiona qualified as a dental hygienist from Manchester Dental Hospital in 1993 and as a dental therapist in 1999 from Liverpool University Dental Hospital. In 2013, she gained her MSc in Medical Education from Cardiff University. She currently works part-time in a busy NHS practice as DPSU lead and is North Wales Regional Lead for Health Education and Improvement Wales. She is project specialist establishing the All Wales Faculty for Dental Care Professionals at Bangor University. She's also an Education Associate for the General Dental Council and an examiner for the Royal College of Surgeons, Edinburgh, and a past president of the British Association of Dental Therapists. She also has an interest in treating anxious patients with inhalation sedation. She's been awarded 2 Oral and Dental Research Trust DCP awards and is currently carrying out health service research at Bangor University for a PhD. Fiona is a Fellow of the Faculty of Dental Trainers at the Royal College of Surgeons, Edinburgh, and sits on the Dental Update editorial board. Sandra Sandom. Sandra is the Clinical Director of North Wales Community Dental Services and Interim Clinical Director of Primary Care Dentistry for Betsy Cadwallader University Health Board. She's on the General Dental Council Specialist List for Special Care Dentistry and Dental Public Health and is a Fellow of the Faculty of Public Health. She also represents BCUHB on a number of All Wales and Welsh Government committees. Sandra has a special interest in dental nurse education, has established a range of courses too. She is also an examiner for the National Certificate Diploma and the Post-Qualification Exam in Conscious Sedation. I'm impressed already. Welcome everybody. And let's move on to the discussion. How are you all?
Good morning, Jez.
Good morning.
Good morning.
Morning.
We're here to discuss the North Wales Dental Academy. And I think the logical place to start is tell us where we are with the targets for the Academy.
I'll kick off with that one. I'm Pete. Jez has introduced you quite well to me there. As the project director, I'll start and other people can jump in as we move along. Where we are currently, if we're honest, we're slightly behind schedule. We've had some issues around the procurement, which means our time frame has extended slightly. So we are probably about 3 months behind where we'd planned to be at this point in time, which sounds a little bit dejecting really, but it isn't. So what we've done is we've utilised some of that time to bring forward some of the work we'd planned to do later, which I know we're going to touch on in some of those subjects a bit later on, but we've done more engagement. So we've been out with a questionnaire to ask people locally what it is that they want to see from the Academy and how much they want to be involved with us, but also in terms of planning and in some of the behind the scenes work, so some of the organisational stuff we've pushed ahead. So in real terms, if we look at a plan, we're probably 3 months behind where we'd like to be today, but in reality, we're not. So the actual position as at today We've awarded the tender that we put out for the academy. We have our preferred provider with us. I won't name them on this podcast at the moment because we're not quite at that stage yet, but we know who they are. We've had some very interesting conversations with them. They're excited as we are to be at the position that we're in and moving forward. So we are just about to hit the mobilisation phase. So we're setting some clear targets and we're looking at getting a defined time frame. I'm not going to say date. I'm going to be very clear. We're going to set a defined time frame for when we think we'll achieve the next stages, which obviously are the opening.
Maybe I can bring other members of the panel in. What are those specific targets and aims of the North Wales Dental Academy? What are we looking to do with this? What's the end game?
I think from my point of view, I'm Adrian. Thanks for the introduction, Jez. Ultimately the aims haven't changed, even though the time frame potentially has. But the aims of workforce planning, which is part of dentistry that we need to be thinking about for the future, the strategy and modernisation via education and training. These aims, which is what we've always planned to do, are still at the forefront of discussion. And from a HEIW point of view, we're wanting to improve education and training, to improve recruitment and retention, not only of dentists that actually come to the North Wales, but actually our existing practice, just to upskill them for the future, to maintain them in the area and become less stagnated in working within primary care. So I agree with Pete, our time frame has slipped slightly, but our targets and our aims are still the same.
Anybody else like to come in on that?
Hi, it's Fiona.
Hi,
Thanks
Fiona.
for the introduction. I would just say that in addition to what Adrian's saying as well, we're looking at expanding the DCP workforce as well, not just the dental workforce. And as part of that, we're opening up educational opportunities in partnership with Bangor University in terms of dental nurse education, and in particular, excitingly, is a dental hygiene as well.
Well, from a Welsh Government perspective, this project is really sort of rooted in our sort of policy objectives, and that is to increase access to new patients with high needs, adopting a preventive approach to care for everyone, and particularly extending the use of skill mix as part of prudent health. Its links with Bangor University really facilitate that. It's about delivering sort of high quality, evidence-based care according to need. That's the principal policy objectives that the Welsh Government have for the North Wales Dental Academy.
I want to move on now. We've discussed the targets and the aims. I would imagine Fiona Sandom touched on this. Training and education opportunities. We tend to think, don't we, when we think of dental surgery, we haven't got enough dentists, but there's a whole panoply of skills, trades and specialties behind that, isn't there? So really, where are we at with training and education opportunities now? Where do we hope to be at with the North Wales Dental Academy? What's the end game and what do we want to see from that?
So in terms of dental care professional education, we've developed 2 dental nurse qualifications which are GDC approved and ready to go. We're currently working with some providers to try and get that mobilised and starting in the very near future. But particularly important and relevant to the North Wales Dental Academy is the development of a dental hygiene qualification, which will be based at Bangor University, and practice placements will be in North Wales within secondary care, but also in primary dental care services. So working alongside with the Dental Academy, we hope to host some of those hygiene students there.
Anyone else like to come in? Sandra?
Yes, Sandra, Sandom. I'd like to just say that from developing the workforce, there are other things to be done as well as dental nurse developments. There's ways of getting into dental nurse developments itself. We're working with looking at opportunities with apprenticeships and with dental health care assistants who then can become dental nurses. We're very concerned about the dropping in numbers of dental nurses nationally at the moment. So that has to be the focus, because we need dental nurses and then they can move on to be hygienists and therapists if they want to. That's another opening for them further on. So it's a progression really. And the other side of it is dental health care workers that are involved with dental health education, and they can then develop into become dental nurses or into health educators further down the line.
Peter?
I think for me, as the non-clinician in the room, the opportunities that we have here for dentists and DCPs are amazing, but I think also the opportunities that we're looking to add to are also for people within the practice who are not clinical. There's a great deal of work that we can do those people again around career development and different opportunities that are available to them. But also within dentistry, we're lucky we sit within the wider primary care family. And there's work that we can do to upskill people and get them experience and exposure across different areas of primary care, because actually in some of the non-clinical roles, the challenges and development that's available to those staff sits across the whole primary care agenda. And we just need to make sure that we're looking at how we offer people the ability to grow in their roles despite what background it is that they've chosen. But I think also from a professional perspective, one of the big aims and one of the big things that I'm looking forward to seeing is the skill mix element and how we're providing training across the whole spectrum that enables skill mix to be enacted, and not just to continue to develop people within their professions and not share the opportunities that come around that for their colleagues.
I just want to step in, if that's all right, and I just want to reiterate what Fiona said. I think we've moved away from the term of dentist and DCP, and I think we should move towards a term of dental registrant. I think that's the first important point, that actually it encompasses everybody here, that we're trying to upskill the whole dental team, not just specific people within that team. And I think this is starting to, it's really a new progressive idea. I don't think it's something that's shown around the rest of the country. So actually North Wales is quite on board with this and really progressive. I just wanted to say, you know, your two questions you asked, Jez, was where are we now and where are we going in the future? Well, there's a lot to improve from where we are now. I mean, we have a really good educational system within Wales. We've got HEIW lead a very extensive amount of postgraduate training, not for all dental registrants, but actually where we plan to be with this is, you know, if you look at what new graduates and what dental registrants want, they want to try and upskill themselves to improve themselves. That's what everybody wants to try and do. And this idea of this dental academy is well placed to do this. This encouragement of training will bring applicants to North Wales. They'll see this as an amazing area to come to because of the upskilling that can be developed here. And, you know, what will that eventually lead to? Well, improving the health of the nation, improving the health of North Wales individuals. So, you know, where we are and where we're going is a stark contrast, and, you know, it will improve people's health.
It's also growing our own talent as well, because we don't have a dental school we only have one dental school in Wales, so we're sort of encouraging people to come to the area, but also encouraging people within the area to upskill themselves as well.
Yeah, and I couldn't agree more with Fiona, Adrian, and Peter's comments there, because I think, you know, it is about bringing the talents into North Wales. It's about bringing them up with broader healthcare, so it's not just specifically dental. It's looking at that more holistic picture, because we're going to need to address some of the population health challenges going forwards, particularly with the older generation. And it's about upskilling all the dental medicine, the whole umbrella, the whole family. And for example, with Bangor University and the dental hygiene program, you know, they're linking that up with the nurse training, which is fantastic. So basically, dental hygienists trained will be working with general nurses, so getting that much more holistic training and exposure right at the very beginning of their professional careers. But coming back to Adrian's point, absolutely, it's about offering an academy which is going to be upskilling the whole of the dental sort of family, and I think that's fantastic.
I mean, it seems to me, from my relatively layman's position, that it's quite a ramping up of the importance of the sector, really, within the whole healthcare setting.
I think it's about being more visible for me, Jez. It's about becoming an area. So if we go back to basics, so we take what Sandra was talking about around progression for people. There are a lot of people, and, you know, I'll include myself in this. I'm a middle-aged guy now, and if you ask me now the same question that you asked me at 14, what is it you want to be when you grow up, I still couldn't give you an answer to that question. A lot of medical professions and dental professions, people see that as I've missed my opportunity. I didn't do it when I was a certain age, and therefore that door has now closed to me. And one of the things for me that we're trying to achieve here is to address both sides of that, really. It's to be clearer with the population what it actually takes to study to become a dental registrant at any point in your career, and also for you to be able to do, I in my clumsy language would call it conversion. It's not quite conversion, but to reach a point in your life where you think, I'm not happy doing what I'm doing now, and I always wanted to do something different, but to know that that's an option for you. So I think, you know, there are two lenses for me on this. There's the lens of helping people develop in the career that they've chosen and to reach whatever heights they want to within that career, but also letting people who think that option no longer remains for them see that there are various courses they could take, and some of that work around the importance of the whole dental workforce and not just around elements of the dental workforce shows people how they can play a part within that.
And this is something as well, because of the nature of the academy, not necessarily based in one particular place in its entirety. There's going to take quite a lot of buy-in and quite a lot of involvement from the existing sort of workforce, isn't it? Tell me a little bit about that.
Actually, that's a great question, because that's one of the areas that I'm really happy about. Actually, we have a very engaged dental community in North Wales. We work together, we know what our issues are, we're very open and honest with each other, and I think that helps, certainly helps. And I think, you know, we've got a lot of people within that dental family at all levels who are passionate about making North Wales a really good place for people to come and live and work. And I'll give you an example. We sent out a questionnaire recently to all of our practices in North Wales, asking them how they'd like to be involved with the academy, what they would like to get from it, but also more importantly for me, what opportunities they saw to engage and give to it. So what would you like to do to support us? And we got a fantastic response to that. When we take a step back in the process, when we look at the tender that we put out to deliver the first academy practice, that's a really large business that we were putting out there. It's a very large scale practice in an area of a lot of need. So there's a lot of challenges that come with that. And that's not something that everybody would feel in a position that they're able to step up and be a part of. But what we're wanting to do is offer people that opportunity to help us achieve that aim. If we're wanting to upskill people, support people and keep them locally, then we need the local dental population engaged in doing that. And it's been great to see such a good response from people who want to be a part of that journey. And I think it ties back into the question you said around where are we now and where do we want to be? Where we are now is at the start of a very long journey, and where I'd like us to be is constantly challenged along that journey with things that we haven't thought about or things that are not an issue today but may well be in 4 years' time. So what we're not looking to do here is set up something that's quite static with a set of aims that we draw a line in the sand today, and that's what we continue to deliver. I had a conversation with somebody about it last week, and my description is this is something for the community, led by the community. So we need to know what our issues are and how we address them. And we need to do that in a different way, because we are, you know, and I'll use we now to cover the health service as a whole and not just dentistry, but we are very slow to respond in the NHS. We see things coming, and it's a bit like when you see a car crash and you can't tear your eyes away from it. You see it very, very slowly happening in front of you, but you just can't respond. And at times it feels a little bit like that, especially in the last 2 years. So we need to be dynamic, and we need to be responding to what people are telling us, and we don't need to deliver in 5 years' time necessarily to what we thought the priorities were today.
I just wanted to add to that, you know, the questionnaire that went out, if you actually speak to practitioners, and I'm still a primary care practitioner, the word on the street is they're excited. This is an exciting time to be involved within this development of this new service. And it's a completely new service that's never been thought of before. Incorporating, you know, education, incorporating training, incorporating prudent healthcare, where individuals are working not at their minimum level, but actually getting them to work at their maximum level. Actually, people become frustrated if you can't work at where you want to do. And it's showing that by individuals coming forward and volunteering to help in this process, people are really excited about it. And, you know, we've got to get it perfectly right.
I'm going to go on to the final 2 questions for you, really. And we have discussed this. We've certainly touched on it in the preceding discussion. But I really want to know what difference the Dental Academy is going to make to North Wales dentistry workforce, and what we're doing about skill mix. We've mentioned it previously, but I want to sort of crystallise really for those people who are working in the field now. What difference is it going to make to them? What tangible things will they see that will benefit them? Because it's a two-way thing. We're asking for input from people, but obviously there's got to be a payoff as well, hasn't there? So what's that going to be?
I can take that from an educational point of view, first of all, and I think Fiona's already touched on it, but the practitioners that work in the area and live in North Wales, in my opinion, not fully utilised. They're our greatest asset. Majority of dentistry is carried out within primary care, and we need to be supporting these individuals. They are, in some respects, the forgotten tribe, and I use that term quite a lot. Many practitioners feel stagnated and trapped, and this dental academy is going to encourage and develop them, upskill this next generation. So that's the first point, the first group of individuals. The next group of individuals are the individuals coming through, you know, these young dental registrants that we need to attract. We need to get them engaged into dentistry, no matter where they are on that journey, you know, from the start, maybe from dental nursing all the way up to specialist level. And we can encourage that by upskilling them, showing them that there's real potential within this profession. The last part is I want to bring up, and I know this is really key with Paul from Dental Government as well, is about improving our practitioners who in primary care to a level of tier 2 accreditation, making them work at the level where they're going to feel really satisfied in doing so. You know, upskilling them to a point where they're actually near specialist level, and that will keep people engaged and interested. So, you know, as I said, the excitement is, you know, off the scale really, and I'm really excited to be part of this project to move this forward.
Yeah, I'd agree there as well in terms of being able to upskill and make, you know, it's an exciting prospect to be able to do that here in North Wales. Everything we've had to do in the past has involved a journey across the border or a long journey down south. So to be able to develop yourself and your career and your potential here locally is just really exciting, as Adrian says.
Finally too, Jez, because obviously with the contract reform starting again in April, then that's going to, we're looking for innovation, and we sort of see the sort of potential move we've talked about across the whole dental registrant sort of family, but the dentists with enhanced skills and what this academy could offer for that. And really sort of North Wales is leading the way from a Pan Wales perspective, and there's some really innovative sort of commissioning which is starting to happen, which is great to sort of see from the Welsh Government's perspective and from my perspective. So yeah, I think there'll be an offer for the whole family of dental registrants, I think, from Dental Academy. And what I would like to sort of see, and I think Adrian, Peter, Sandra and Fiona would all say the same thing, is for North Wales to be really leading the way for innovation across Wales. And I think with this and a number of other things that are going on, I think that this is the start of that journey, which is great to see.
Dentists with enhanced skills is certainly the way forward. We've made a start with the orthodontic dentists with a special interest, and that model is one that should really make things fly in North Wales.
As you will know, the periodontal one and the oral surgery one is already being developed, Sandra. So yeah, this is a really exciting time. So
essentially, I mean, I could distill that and say it's the body politic meeting the aspirations of the professionals that we have, really, isn't it?
I think for me, Jez, the interesting thing, so I always love having these conversations, because as the non-clinician and the one who doesn't really understand a lot of what we talk about in a lot of these discussions, the really key thing for me is that I listen to the discussion from my clinical colleagues, and I think that's great. So, if we talk about what difference is the academy going to make, there's two levels to that for me. One of them is it has to be a success. So whatever outcomes we've said that we're going to do, we have to deliver on those, and we have to go past them. So, this is the starting point that we're talking about, not the end point. But also the best part for me is that it makes me sit here now and feel really quite nervous, because there's the easy side of the academy, and I'm going to call it that, but that's the front facing, the stuff that people will see, touch, feel, smell part of it, which will help develop everything. And there's the bit that absolutely scares the life out of me, that's how am I going to go away and make the changes in how I currently run the dental service in North Wales, the bit where I interact back into the organisation, the bit where I interact back out with practitioners, to make sure that what we're not doing is what's happened in the past, is we're sending people away, we're coming away from the practice, they're coming and developing a skill, they're taking themselves to a point where they are on that route to becoming a specialist, and then nothing happens because there's no work for them to pick up, we're not commissioning services for them to deliver, and then all of that skill goes to waste, because what we're doing is investing time and money in practitioners that move elsewhere. So as much as it really excites me to hear the conversation and to think we're all aiming for the same thing, I find it quite good that it challenges me, because it means that I have to go away and make it happen. This isn't something where we're making false promises. This isn't a badge, a label, a tagline that we're hanging on something. This really is us saying we need to make a big difference in North Wales, and we all need to be at the same party to make that happen.
But one of the great things, Pete, is the fact that it's not just yourself. And I think without innovative commissioning, what you're doing within BCUHB, then the project doesn't really get off the ground. But I think, and so that's been fantastic to sort of see. But I think one of the other things is that in system change, you need multiple stakeholders all working together, coming from their different perspectives. And one of the great things about the Dental Academy is that everybody is keen to push it forward, and we'll all be bringing in our skills. And I think it will almost develop its own natural momentum as well, which I'm hoping will be able to, propel it forward. But I think the big thing with any sort of system change is that you need the people and all the stakeholders to be aligned, and that's what we've got, which is fantastic.
I'm afraid we're approaching the end of our time for this particular podcast, so I think that pretty much wraps up today's. Hopefully it's given people a flavour of what the North Wales Dental Academy aims to achieve. We'll be holding more podcasts in the future, so if you've something you would like us to discuss, an observation you'd like to make, or a question for our panel, get in touch using the contact email displayed on screen. And my thanks to the panel and to you for looking in on our podcast, and we'll see you again very soon. So thank you and goodbye.